Hi everybody, this is Dr. A with our second video on Labware. We're going to look at glass and pipettes. Alright, so regardless of composition, most lab supplies must need certain tolerances of accuracy. Vessels holding or transferring liquid are designated either to contain or to deliver a specified volume, and that is self-explanatory there in their terms. Most labware can be divided into two main categories according to use. There are the containers and receivers, such as beakers, test tubes, Erlenmeyer flask, and reagent bottles. And then there's also the volumetric ware, such as automatic and manual pipettes, volumetric flasks, graduated cylinders, and burettes. Volumetric ware obviously are used to determine or measure a certain volume of something you're trying to measure, usually liquid, but yes, volumetric ware. Plasticware is less expensive and more durable than glassware. It is preferred for certain analyses in which glass can be damaged by chemicals used in the testing. For example, alkaline solutions must be stored in plastic. That's what bleach is in plastic bottles. The disadvantages of plastic are that there is some leaching of surface-bound constituents into the solutions. There is some permeability to water vapor. There is some evaporation through the breathing of the plastic, and there is some absorption of dyes, stains, or proteins. And of course, that could be a problem if you're trying to analyze proteins, if the proteins get stuck on plasticware, like plastic transfer pipettes, for example. Glassware has a higher chemical stability and clarity than plastic. Clinical and research lab use glassware for analytical work. Certain types of glass can be attacked by reagents to such an extent that the determinations done in them are not valid. So it is therefore very important to use the correct type of glass for the testing that's being done. And the types of glass that are available are thermal resistant borosilicate glass, aluminosilicate glass, acid resistant or alkali resistant glass. There's also low actinic or amber colored glass, and there's like this and this bottle of essential oils, but those are usually protecting their contents from light because it can be degraded by light. In the lab, it's often used in quality control vials. There's also flint glass. Those are used for the lenses of the microscopes and stuff. And then there's disposable glassware. Just think of test tubes that are disposable. That would be disposable glassware. The containers and receivers are your beakers, Erlenmeyer flasks, test tubes, and reagent bottles. Pretty easy there. And then your volumetric glassware. It is worth noting that a rigorous process of volume calibration ensures the accuracy required for lab determinations. In very precise work, it is never safe to assume that the volume contained or delivered by any piece of equipment is exactly that indicated on the equipment. So therefore, there must be some calibration of volumetric glassware for that very precise work. The volumetric glassware includes volumetric flasks, graduated measuring cylinders, and burettes, which are like long pipettes with a stopcock at the end. And of course, in here, for example, in the volumetric flask, if it's said to hold 100 mils and you see their line right here, that means that if it is filled to the line with the bottom of the meniscus going to reaching the line, then it should hold 100 mils. You have your volumetric pipettes also in the pipettes. So the volumetric pipettes are a pipette usually with a bulb. There, it's not a soft bulb, it's a glass bulb, and it only ever holds like one volume. And so that volume is usually indicated on the bulb. It could be 1 mil, it could be 3 mils, it could be 5 mils, it could be 10 mils, and there's usually a line somewhere above the bulb. And again, you have to get the liquid where the bottom of the meniscus is reaching the line, and then that pipette should have that specified volume that is on the bulb there and should deliver that to, you know, your reagent or bottle, whatever you need to dispense it in. There are also graduated or more pipettes and serological pipettes, and the difference between the two, they look very similar. So you see them here side by side, is that The graduated one, they're not graduated all the way to the tip. There's a section here that's not graduated, whereas the serological pipettes are graduated all the way to the tip. So usually the more ones, there's a stop here, and it's a little bit less accurate or less precise here on the graduations and stuff. And so you can see it here also. This one would be a more, and this one would be a serological one. And then pipettes can be to contain, and if they're to contain pipette, then everything needs to be blown out because it's meant to contain that volume, so all that volume needs to be dispensed. If it is to deliver a pipette, then usually whatever has been dispensed should be the volume that was, if you pull it up to like 10 mils or whatever, it should be to 10 mils. Even if there are a few drops of a little bit remnants left inside. If a pipette is marked as a blowout pipette, then it should be blown out with a bulb. So it's usually a squeezy bulb, and you can use it to blow some air through it to push the rest of the liquid out. A blowout pipette is always going to be indicated with a double ring on the tip of it. There are also some micro pipettes. These are to contain pipettes. These displayed here are like micro pipettes. They are micro pipettes because they usually don't hold more than 1 mil, and they usually operate in microliters. So, with volumes as small as 3 or 5 microliters or 10 microliters to 100, 250, 500 microliters. And they are to contain, so usually when you dispense it, it blows. There's a step where you kind of blow everything out, and your pipette tip should be completely empty. There are also self-filling pipettes and capillary pipettes. Capillary ones would be really thin, really small. And then lastly, on cleaning, only larger pieces of glassware such as volumetric flasks, pipettes, and graduated cylinders are usually cleaned. And the pipettes that are clean are going to be the glass ones. A lot of labs will use plastic pipettes that are disposable, so they don't have to clean them. Glassware that's contaminated, as by use with patient specimens, must be first decontaminated before it is washed. Again, most serological pipettes used in the lab are plastic. They come actually wrapped. They're sterile, and they are disposable and one use only. But if your lab has glass pipettes, then those will need to be cleaned and then reused because they're expensive. And then if any glass is broken, whether it's a pipette, a beaker, volumetric flask, or whatever, you should never use any kind of broken or chipped glassware. So there you go. That wraps up second video on Labware. Thank you.